The 8-month-old infant admitted to the Badulla hospital with symptoms of COVID-19 has tested negative for the virus. Upon confirmation of test results, the infant was discharged today. In the meantime, it was confirmed that another infant of 11 months admitted to the Anuradhapura Teaching Hospital on Wednesday with COVID-19 symptoms has been transferred to the Infectious Disease Hospital in Angoda. The infant had recently arrived in the country from Italy and was admitted with a fever. With the reach of COVID-19 increasing across the globe, the risk of infections being recorded on Sri Lankan soil is also on the up. With the risk in mind, the government took measures to screen and quarantine passengers arriving from South Korea, Italy and Iran for 14 days. For this purpose, it decided to transform the leprosy hospital in Handala to a quarantine facility. But all are not happy with the decision as protest over the move continues for a third day today, demanding that the facility be located in a more remote area. Meanwhile, in another move to curb a possible outbreak of the virus in Sri Lanka, the Ministry of Education today stated that students and other individuals involved in educational activities who are returning from countries affected by COVID-19 will be subjected to a 14-day quarantine. Accordingly, the ministry has instructed all the heads of schools and other educational institutions to inform relevant students, academics and non-academic staff who are arriving in Sri Lanka from countries hit by the virus, including China, South Korea and Italy, that they will be quarantined for a mandatory period of 14 days. What's more, President Gotabaya Rajapaksa has instructed members of the special task force set up to monitor and discuss preventive measures against COVID-19 in Sri Lanka to formulate a scientific mechanism to prevent the disease entering the country. In a statement, President Gotabaya added that it was the duty of the people arriving from foreign countries to act in a socially responsible manner if they have any symptoms of the virus without concealing it. As at 5:35 p.m. Sri Lankan time, the novel coronavirus spread to 94 countries, recording a global death toll of 3,408 and 100,242 positive cases of infection. Italy confirms the highest death toll outside mainland China with 148 fatalities and also confirmed 3,858 cases of infection. A significant hike in COVID-19 cases in Europe is noticed as fresh cases have been confirmed from various countries across the continent. In the US, meanwhile, 14 overall deaths are reported along with 233 infections. Meanwhile, in Iran, one of the worst affected countries outside China, 124 deaths were reported with the number of COVID-19 infections also jumping to 4,747. South Korea, meanwhile, might not be leading in the number of COVID-19 fatalities, but the country is in the number of infections. With a total of 6,593 cases confirmed, is only second to China in the number of infections. No Sri Lankan living there is infected with the virus yet. With the number of overnight deaths being 30, COVID-19's grasp on China will and truly looks to be weakening. The country, however, has so far suffered the loss of 3,042 lives owing to the virus, with a staggering 80,559 infections. The World Health Organization, meanwhile, called for a holistic governmental approach from all countries in combating the COVID-19 outbreak.
We are concerned that some countries have either not taken this seriously enough or have decided there is nothing they can do. We are concerned that in some countries the level of political commitment and the actions that demonstrate that commitment do not match the level of the threat we all face. This is not a drill. This is not a time for excuses. This is a time for pulling out all the stops.
I hope that
there are a good number of countries who have left this epidemics up to the Ministry of Health. The Minister of Health and the health emergency institutions. We're saying that's wrong. It needs a whole government approach.
චූරයන්ගේ නොබිඳෙන විශ්වාසය සමගින් මැක්සිස්